Hyperglycemia is a condition where the blood sugar levels are elevated. Normal blood sugar levels vary slightly depending on the testing laboratory, but in general, they should be between 70 to 100 milligrams per deciliter. A blood sugar greater than 125 milligrams per deciliter is considered elevated. Hyperglycemia is a sign of diabetes as well as prediabetes. It can also be seen with pancreatitis, certain endocrine disorders, and with infections. The treatment of hyperglycemia depends on the severity. Mild hyperglycemia can be treated with diet, exercise, and lifestyle changes. Severe hyperglycemia may require medications such as insulin, IV fluids, and hospitalization in some cases. It is important to have a blood sugar that is in the normal range. If blood sugar levels are elevated in the blood over a long period of time, this may lead to many medical conditions such as heart disease, vascular disease, kidney disease, and as well as poor eyesight and nerve damage. The good news is that hyperglycemia can be treated. You may have been prescribed medications. If so, take the medications as directed. You may resume your other medications unless you were told not to do so. It is important to make some dietary changes. Reduce the amount of simple carbohydrates and foods that have added sugars in your diet. Keeping a log of your blood sugars is helpful. It helps your primary provider determine the type and amount of medications you may need. You will need to follow up with your primary provider for a follow-up visit. Call their office for an urgent appointment. At your follow-up visit, ask your doctor if you can start an exercise regimen, as exercise helps normalize blood sugar levels. At this time, it has been determined that it is safe for you to be discharged. There are some instances where complications can develop. Therefore, it is important to contact your primary provider or return to the emergency department if you develop the following: increased thirst or increased urination, increased fatigue or weakness, rapid breathing, this might be a sign of ketones in your body, fever, abdominal pain, a fruity odor to your breath, this might also be a sign of ketones in your body, decreased level of consciousness, your blood sugars are greater than 350 milligrams per deciliter, your condition worsens, or new symptoms develop.